call you.
Okay. Good evening. I'd like to call the Board of Health meeting to order at 4:39 p.m. If everyone could please rise for the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. I'm going to read the order from Governor Baker. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 38, Section 20, and the Governor's executive orders imposing strict limitations on the number of people that may gather in one place, although a quorum of the members of the Dudley Board of Health will be physically present for this meeting, no in-person attendance of members of the public will be permitted. The meeting will be live broadcast on Dudley Cable Access Channel 192, and members of the public can also access this meeting online. In the event of an unanticipated interruption in the broadcast, we will post on the town websites an audio or video recording transcript or other comprehensive recording or proceedings as soon as possible after the meeting. Members of the public who wish to appear before the Board of Health must make an appointment to appear on an upcoming agenda by contacting Jennifer Knoyer, 508-949-8007, or watersewer@dudleyma.gov. Placement on the agenda is not guaranteed, however, and the persons requesting to appear before the Board of Health should not attend a meeting in person unless and until the appointment has been confirmed by the Board of Health. Persons with matters appearing on the meeting agenda may request that they attend via virtual means rather than via in-person attendance. Such requests should be directed to Jennifer Knoyer at 508-949-8007 or watersewer@dudleyma.gov no more than 72 hours, not counting Saturdays and Sundays or legal holidays, in advance so that appropriate arrangements can be made. However, persons or representatives with matters appearing on the meeting notice agenda who wish to be physically present at the meeting must observe the following requirements. In accordance with existing requirements imposed by the governor, meeting rooms will be limited in terms to the total number of persons that may be physically present at the same time, including board members and staff. Satellite rooms will be available for overflow, and the meeting will be broadcast in real time in those satellite rooms.
All in one breath.
Here we go. Persons who wish to participate in any particular matter on the meeting agenda will be asked to be waiting in a satellite room until that agenda item is reached, at which point attendees will be rotated between the main meeting room and satellite rooms as appropriate. Social distancing must be maintained in both the main meeting room and in satellite rooms. Face masks or coverings will be required in accordance with Governor Baker's May 1st, 2020 COVID-19 Order Number 31. Order requiring face mask coverings in public places where social distancing is not possible. A copy of that order can be found at www.mass.gov, document May 1st, 2020 masks and face coverings. Failure to comply with these requirements may lead to an attendee's removal from the meeting. Okay. That's done.
Need some water.
So we did the pledge. Up next is some COVID updates. So what do we have?
That's funny. COVID updates.
Yes.
Can I roll my public health nurse comments in there?
Yeah, you can do it all at once.
Thank
That's
you.
fine.
So we have 2 active cases. Schools are getting ready to open. Pre-K to 4 opening next week on the hybrid model, and then 2 weeks after that, 5th grade to high school is opening, hybrid model. Everyone's full remote right now. Nothing really. It seems like, I hate to say things are going okay, I hate to jinx, but I know. Seems like it's, that's all I'll say about that COVID stuff. I don't want to jinx anything.
Okay. Anyone have any COVID-related questions for Ro? Okay.
Things are, like they said, like Roberta said, they're pretty quiet.
Yeah.
Scary.
Calm before
We're
the
already
storm.
seeing an
uptick.
areas around us, we're seeing upticks already.
Yeah.
Worcester just went into red today.
Awesome.
Some states came off though, so it makes you wonder, you know what I mean? Like some towns have changed different colors, but states are coming off, so it makes you wonder, you know, they're coming off and we're slow and we're changing here, and then other, you know, then we're gonna change, and then they're, you know, it's just kinda weird how it,
Ebb and
I don't
flow.
know.
Ebb and flow.
Just go with the flow, girl.
Okay, you
Go
know?
with the flow.
Okay, so then we'll move on to number 3. Well, actually, Tom, we'll skip number 3 and we'll go to number 4, which is your health agent comments, then we'll go back to 3.
Okay.
Not good.
Just to let you know, just as a reminder to the rest of the board, Club Jigger has opened up now as far as a restaurant is concerned. They're gonna operate as a restaurant. We had a very nice meeting with them. One of there's still a couple of other people trying to test the water. The PNA tried to test the water, and they found that their physical plant, actually, the layout of the plant isn't conducive to the rules. So, because everything around there, it's all a bar setup. And even though the new information coming out from the governor was the bars are gonna open, but they're not. The reality is with the bars, you're gonna have seating, but they're still gonna have to be 6 feet apart. And on the back side, there'll be no serving over the bar. And the way to prevent that is what they have to do is they have to put the shields on the back side of the bar between the customer and the bartender, and they're gonna have to be 3 feet tall. So there'll be no service or passing food over the bar. Literally have to come out,
Have to come around to
serve
to give you
serve
your
the
bill.
food, serve the drinks.
Stop.
To take the bar, and it becomes cost prohibitive.
Right.
The plexiglass is a killer, as
Yeah.
far as
As we
having
know.
to go in and start putting all that stuff up. It's not cheap anymore. So, there's a little bit of misconception. People think that all the bars are gonna open. It's not gonna happen. Matter of fact, there's not even any state guidance that's been out. I've been looking for it for 2 days now.
Maybe tomorrow. It's Friday tomorrow. That's what's gonna happen.
Yeah,
Surprise.
but that's right now, we're trying to schedule everybody so we can do a quick review or a meeting or see what people have to do to get qualified to do it, and we don't have any rules to go by yet. I don't want it, and Monday, it's coming up on Monday, so what do I have to do now? I gotta wait until Sunday or
Yeah.
Saturday and then call everybody and say, if you want to come up and let's discuss it. But I'll give you the parameters and what you have to do to be able to do the bar seats or the bar stools. A lot of places think that, like donut shops and ice cream parlors, think they're gonna be able to open up their counter. They're not gonna be able to do it, so. Restaurants, Julie and I hit a good number of them over the week, or last week. We got about a dozen more to do, and we'll clean it up. We'll try to get what we can, this week, and, see if we can wrap up. Another hot potato was 37 Schofield Ave. I have a meeting with the landlord tomorrow. I've already broached a lot of the subjects on the phone, and he's already ahead of me on that, so. The dumpsters are empty, the trash is being picked up, the nephew is out of there. Unregistered motor vehicles, he might have a little problem with one extra one, but that's because he can't get into the registry to get that stuff, so. You can't get plates, and you can't do registrations, so. I'll be meeting with him tomorrow anyhow to see if we can get things done. As far as all the other work, it's all pretty well cleaned up. The perk tests, I think I'm all caught up. I might have 1 or 2 more, and that's it. But I'll get those within the next week. We'll get them all cleaned up, so. Plans are all done, all reviewed and approved. I've already showed you how to do some of the inspections. Remember back to the classes,
Oh, yes. Yeah.
okay?
Yep.
So if you have to go out and do a septic system inspection. Don't worry, it's a redundancy anyhow, because the engineer himself has to come out.
Right,
All you're doing is keeping the engineer honest.
right, right.
So if you want to fill in for that, whatever. Effective September 30th,
Yes.
I'm done. I'm retiring again.
Who keeps retiring?
I retired, I turned in my papers also for Oxford, so I'm getting very tired. It's starting to wear on me, and then it's got, my Florida time is coming up for the next, 4 out of the next 5 months is Florida time, so.
Oh, we're coming with you?
I have a 3-bedroom condo,
See, you
And-
see that?
Yep.
and if you don't mind, I mean, hey,
That
Sounds good.
for you,
we're all
Tom.
set.
3 meals a day.
Yep, let's
Good.
book it.
I do cook, yes.
I know.
Sounds better and better every day.
No.
Yeah, I do cook, and it's more than just hot dogs and
yeah.
Franco-American spaghetti. So.
Mm-hmm.
Sounds good.
So, Tom, how long have you been here in Dudley? I couldn't remember.
Off and on,
You lost count.
30 years.
Yes, that's what I thought.
30 years off and on. There were a couple of gaps in there, but
You've been doing this not just in Dudley either. I mean,
Oxford, I've been doing it for almost 40 years.
Yeah.
Wow.
you've been doing this a long time, so we regretfully accept,
Well,
But we
thank you. It's regretful I have to turn it in, but,
but it's complete, I mean,
you know,
we all have seen how it's worn on on everybody, but we've seen it on you, and you deserve some time.
I'll be 72,
Yeah,
so it's time.
It's
you
time.
deserve,
Go live life.
You don't need to deal with all the crap,
Minutia.
the minutia. And all this COVID certainly didn't, try
Well,
to-
we're out there, and all of us, I mean, we're out there in the front line, if you want to call it. We're not really up in the real front line,
No.
No,
but we're in there, and we're in all these places all day long, and we're going into hot zones,
And like you said earlier, it's 7 days a week, 24 hours a day.
well, there's a
Yeah.
prime example.
Exactly.
I watch the emails coming out of you, 7 days a week.
Yeah, I know.
Saying it's
I'm
with
tired.
myself,
I'm tired.
God love you. It was,
It's been,
it's a lot of work.
Yeah.
I mean,
And the more I find out about like the contact tracing and everything else, I mean, when you talk about 6 or 7 hours for each one, that's hundreds and hundreds and hundreds of hours that you put in. That, and then what happens is you can't do anything else. You can't do all your regular day-to-day stuff. You can't do code enforcement. You can't go chase the problems.
no,
A lot of things that need to be done.
right,
That's why the staff, everybody was grossly understaffed. We
absolutely.
weren't prepared for anything like this.
No,
Sad thing is that there's a few big organizations at the upper state level that want to come out and privatize the whole thing and take all the public health stuff away from the locals. They want to create their own companies at the colleges. They hire all the students. Well, that's what's happening.
Yeah, right.
See, the whole industry, I've watched the industry change. BU sets up all these local Board of Health programs and all that. What they're doing is they're trying to build a system where it becomes, we're gonna have a regional setup, and they're gonna be the controlling people. It's not gonna be the locals anymore. When the governors wanted to privatize a lot of the stuff, that's what's happening, and becomes impersonal. You've already seen that.
right, and that's,
It becomes very impersonal. You have no contacts. You can lose a problem just like that.
Right.
no, and we, that's why we wanted to be involved, is we care about our town, and we don't want to lose that. And
Absolutely.
And the Board of Health has a lot of, we have a lot of good things to do for the town and a lot of power within the town. and we don't want to lose that.
You know,
No.
we've got, these are our friends and family, and these are personal contacts that we all have, and we all want to be helpful.
Right, it makes a
Nobody
difference.
wants to be out there and browbeating people and punishing people. We're not here for that.
No.
We're not here for that. We're here to educate people and to keep them safe and protect them sometimes from themselves.
Right.
But
Yeah, that's exactly.
that's what we gotta do.
And I just want to thank you and for everything you've done over the years, all that you've taught me, all the trainings we've gone to. I've learned a lot. Hopefully I remember some of it. Some of it did.
Oh.
And also extend thanks to Julie when she's covered. We appreciate that when, you know, when you would go to Florida and Julie would cover. And thank you to your family because you put up with a lot, you know. And Kathy dealt with a lot. So we
Thank you
appreciate
very
it.
much. I really appreciate it. And I really was satisfied doing the job.
Good. Oh, that's, you gotta love what you do.
Kathy never bothered me because she know I love doing it.
Right. Right. But it's time for you. You know, you can have that romantic getaway to Florida, the two of you, and walk on the beach and.
Well,
Mom's gonna take a nice long nap.
Yep.
I can't go too close to the water because they'll push me in, so
Yeah.
they'll try to push me back.
So that was my number 3 thing, that Tom would be leaving us. So, thank
Thank
you.
you.
So now we'll move on to, we don't have any public, so any board member comments?
Pretty quiet on the front.
Okay.
Right on.
Okay. I just have a couple, nothing, everything's good. These are just some general, no, it's okay. Just that early voting is coming up
Mm-hmm.
and voting. And just a reminder that masks need to be worn.
Mm-hmm.
If you have a medical or a reason where you can't wear a mask, when you come in, just please inform the person right there. We do have precautions set aside, how to handle that type of situation. We just want to protect all involved.
Mm-hmm.
So we do have that. The town meeting is coming up on Monday, October 19th. As with the last town meeting, masks will need to be worn. There'll be social distancing. Everything will be sanitized in between, just like the last time. So we're working hard at that. I've talked with Lori about both of them, the town clerk. So we're on point for that. I figured what we did last time worked really well.
Yep.
We're just gonna continue it this time, so. And then, I just wanted to inform everyone, it's on, the Facebook page, it's on the Town of Dudley Library's Facebook page. Due to COVID, we cannot have our spooktacular that we normally have. This would have been our 3rd annual one. So, the Town of Dudley came up with a scarecrow contest, where residents, businesses, any group can participate. You're going to, there's entry forms that are available online. You fill out the bottom, you can bring it to the library, 3 different dates, September 28th from 10 to 2, October 1st from 3 to 7, or October 2nd from 10 to 2. They then will give you a laminated pumpkin with a number on it, and then we'll be publishing a list so that you can drive around town, see where all the scarecrows are posted out on the lawn. Something to do, you can get together as a family, make a scarecrow. It's a great family event. Plus then you can take a Sunday afternoon, go for a drive around, see all the scarecrows. And then the week of, the week of October 26th, there'll be some judges that will go out, and there's going to be judging, and prizes will be given for the scariest, funniest, most unique, best family presentation, best dressed, and best representation of Dudley.
Oh, cute.
You can also send your pictures into the pearl@cwmars.org, and they'll put the pictures on the library Facebook page as well as the town Facebook page. You know,
Yeah.
just, we wanted to come up with something to keep families involved at home,
Yep.
and also something that you could go out, drive around, take a look at scarecrows, make a nice afternoon of it or something. So if you have any questions regarding it, you can contact the library, or you can contact the Board of Health, and we will refer information on and tell you where you can get the information. So I think it'll be a great thing, and town employees will be doing some on the front lawn. So ladies,
Oh, I
get your
love
thinking
it.
cap on for Board of Health.
Ooh.
Oh,
So we will be doing some scarecrows out on the front lawn, and just would be a fun, good thing to do.
Absolutely.
okay.
And
Oh, my.
the last thing I have is I wish the schools a good, safe start. I know they've been remote, but they're gonna be going back in person. Hoping things go well. And we'll take it from there, so.
Have you decided what to do with Halloween?
I know DPH is coming out tomorrow with some guidance.
CDC
CDC's
is
recommend,
already suggested that
right,
they don't do it.
right, they're saying you don't do it, and if you want to do it, then that you should put individually bagged little goodie bags out, not have kids reaching in bowls and close
Right.
contact. Once we hear the DPH guidance, we will, definitely be throwing it around, and then
Talk to Charlton.
talking with Charlton, only because we have a regional school system.
Yep.
We think it's a good idea that we kind of mirror each other, because one allows, one doesn't, then you have this, you have that, so we're looking out, so.
One of the other hot issues that's going around right now are requests for what they call trunk and treat. They bring a bunch of cars into the parking lot, send the kids around. Even that's not recommended, so.
No.
Again, what's happened is people are handling product, or they're letting people reach into product.
Right.
They're not being protected.
No, and that's what, it's, I feel, I mean, your child will be dressed up, they'll have a mask on 9 times out of 10, the costumes do, and then if not, they will have the mask. But it's the handling of the candy.
Right.
It's the hands, the multiple hands reaching in the baskets and the candy.
Right.
That's where the biggest area of concern is, that I've been
Right.
seeing. And
Right.
that's why they're saying, if you want to do things like that, then have individually little wrap
Right,
bags that they can
exactly.
just grab, leave
Plus,
them at,
the parents are thinking of those things as well. If they're gonna send their child out, or have candy available, then
Right.
I would put thought into that. Like, instead of having a bowl and everybody reaching in, have a nice big table layout and
right,
put your individual pieces out.
Yep.
right, and they're advising, like, go to your families,
Right,
go
go
to
to
your
who you know.
friends, not doing the mass neighborhoods, like so
Right,
many,
yeah.
I mean, and it's common sense to us, but again, once we get the DPH guidelines, and we will put all that out there and go from there.
Yeah, tomorrow.
So once I hear anything, yeah,
Mm-hmm.
so
Okay.
we'll see what happens.
I think the same concept for trunk or treat could work, with tables with individual products set out on it.
I think the only problem with that is trying to keep the kids spaced out more.
If they're coming with their families and walking from car to car.
You would
People are
hope.
pretty leery, they're making wide paths in stores and.
Right, you would hope, that's what I would hope. I just never, you see so many things. But, so we'll see what DPH,
Their recommendations.
and see if, we'll go from there, by all means.
Yep.
So, anything else?
None from me.
Then I will entertain a motion.
I'll make a motion to adjourn today's meeting.
I second that.
I have a motion and a second. Any other discussion? Seeing none, all in favor?
Aye.
Aye. Motion carries, meeting adjourned at 5:03 PM.